Hi, I'm Jenny Mills and welcome back to Parenting Through Addiction. Today's parent guide is to introduce to you the information about why traditional parenting interventions don't work with true addiction. I want to help you begin to recognize why rewards for good behavior or punishment for bad behavior are ineffective when it comes to responding to the addictive behavior of a person whose use of substances has moved beyond behavior and into disease state. So let's get started. Two of the most important things to understand about our son or daughter's actions is to try to understand their willingness to change their behavior and their ability to change their behavior. So let's think about it this way. If your son or daughter has the ability to change their actions, but an unwillingness to change their actions, I'm going to call that behavior that is likely to respond to a behavioral intervention. What does that mean? Well, it means that the idea of rewards and consequences might really work. Because you see, they have the ability to make change in their actions. On the other hand, if your son or daughter has the willingness to make change in their actions, but the inability to make change in their actions, that's a very different scenario. That means that they would if they could, but they can't. And when we know that they would if they could, but they can't, then and drugs or alcohol are involved, I'm going to make the argument that that's a good way of knowing that this has crossed from a behavior that will respond to behavioral interventions like rewards and consequences, and it's moved into an addiction or a disease state that really necessitates treatment. You love your son or daughter better than anybody else on the planet. You can implement and employ behavioral interventions in a way that might create behavior change or change in actions for a son or daughter who is able to make change but who hasn't been willing to. On the other hand, if this has progressed to an addiction or a disease state, then you need the help of professionals, or better yet, your son or daughter needs the help of professionals in order to change their actions, because this has moved into something that is outside of their control. Now, I'll tell you that one of the most challenging of circumstances is when you have someone who is both unwilling and unable. And that's where we experience a lot of denial. That's where we experience the person who believes that they can make behavior change or change their actions, but they have no willingness to, they have no desire to, and when they try, it doesn't accomplish much, and so there are ways in which they stay trapped in that cycle of unfortunate action that is making the disease worse and worse over time. So our job as parents is to be able to recognize the difference, whether they have ability or willingness, inability, unwillingness, or some combination of the above. As we have a better understanding about what's going on with our sons or daughters in terms of their willingness and their abilities, it helps us know what will be most effective. Will rewards, like offering to buy you a new car if you drug test negative for a year, be sufficient to help your son or daughter feel motivated to make change? Will the opportunity to learn from consequences and experience pain help your son or daughter decide to employ that willingness and make changes in their actions? If that's the case, then it's likely that your son or daughter has not crossed into a disease state or into addiction. But if rewards or consequences repeatedly prove to be ineffective, there's at least some likelihood that your son or daughter's use of substances has progressed from a behavior to a disease state of addiction. And in that case, they need professional help, and so do you. As an independent addiction specialist and parent consultant, I can be a part of helping you know where your son or daughter is on that continuum and what professional resources may be necessary to help move them from active addiction disease state and into active recovery from that disease.